In the ever-evolving healthcare landscape, prioritizing initiatives to improve margins is crucial to maintain financial stability.
Network integrity is the ability to keep patients within the organization-defined provider network. Join us as we explain how network integrity can optimize your hospital's financial and operational performance.
Hi, I'm Shawn Williams, an Audit Director in our healthcare practice at Blue & Company.
And I'm Crystal Bingham, a manager in Blue's Hospital and Physician Operation Team. In our last video, we covered how a health system on the East Coast activated network integrity to improve patient loyalty and create better outcomes for the entire hospital system. In this video, we're going to cover how we at Blue can help your hospital system improve network integrity and see positive returns. The reports generated through a network integrity analysis provide organizations with the data to develop a roadmap to improve market share and in turn, improve your margins.
As leaders build their strategies, areas that they may find and focus on are the following: meeting with multi-network providers to discuss out-migration patterns,
Reviewing relationships with contracted providers to view where they are performing their procedures and referral patterns of their patients, strategic placement of providers in certain markets where leakage is occurring,
improving access to identified service lines, identifying barriers that prevent seamless referrals,
improving relationships with referring physicians, forming strategic partnerships with physician groups that are causing patient leakage, developing business cases for service lines that do not exist in the health system and the data shows there is a need for it in the market.
improve patient experience in the referral process to decrease leakage, evaluate competitor data, and develop a strategy to move leaked procedures back to the health system by evaluating rendering providers' relationships.
Common strategies that organizations can focus on are access, patient experience, provider experience, and improvement opportunities. The following roadmap is an example of what leaders can build after a network integrity analysis has been completed.
The claims data is collected using secure data. The lag time for Medicare data is approximately 6 to 9 months, while a lag time for commercial, which includes Medicare Advantage, is 3 months, but can vary depending on the data source and vendor. The claims are blinded to ensure the confidentiality of patient information and to meet other HIPAA requirements, with resulting variables for patients that can include charge data, a random patient identifier, procedure reflected as a CPT code or MSDRG, and the patient's zip code location. The database allows management teams to analyze any hospital or physician based on an MPI, the charges incurred based on date, procedure, geographic location, and insurance payer, which is not an inclusive list. These are the strategies we've employed at several of our healthcare clients to improve their patient loyalty. Most hospital systems struggle with understanding the referral patterns and keeping patients in network. So let Blue assist your organization in understanding the data to come up with a solution. Healthcare organizations focusing on improving margins can start by performing a service line assessment. A data-driven method to get a baseline of the current state of the service line can be done by performing a network integrity analysis using claims data. And in doing so, organizations can develop strategies that can prevent leakage, improve the experience, and evaluate new growth opportunities that can improve the bottom line.
If your healthcare organization has any questions or would like to learn more about network integrity and how Blue can help you, please reach out to us.